Welcome everyone to this event. I know some celebrate STD during the week, like the CDC, and others celebrate it during the entire month. So depending on which organization that you belong to, or that you look up your information in terms of sexual health. But this event is co-sponsored by Detroit Community Health Connection, which is a federally qualified health center in downtown Detroit. And they have 7 health centers throughout the city of Detroit. I work there as a clinician on a part-time basis, and also my research is there. But my primary appointment is at the University of Michigan School of Nursing. I'm Dr. Jade Burns, and I do research with adolescents and young adults, specifically youth of color and young men, to improve access to sexual health services and just overall health care. Today we have, we have the Center for Sexuality and Health Disparities. We have one of our speakers, or 2 of our speakers are from that fine center. And this is also with the DRB lab, which is a research lab as well. And so I'm going to introduce Dr. Cornelius Jamison and Tanaka Chavanduka and Ayanna Walters, who is from Connect to Protect, Detroit, and Wayne State University School of Medicine. So if you all could drop in the chat where you're from, that would be great. And where you represent, whether it's the city or the place that you work. We're so happy to have you at 2 o'clock on a Friday afternoon. So thank you. So I'm going to first off talk about Dr. Cornelius Jamison, who is a health service researcher on STI and HIV prevention among minority populations. And he is currently on faculty here at Michigan Medicine, and he's also the co-director of the Adolescent Health Initiative. He has his medical degree is from East Carolina University, and he's got a master's in public health from Tulane University and a master's in science from the Health and Healthcare Research from the University of Michigan, where he did a fellowship through the Institute of Health Policy and Innovation. And he is family medicine. And so if you're looking for a primary care provider, I'm sure he can take care of you. So that's Dr. Jamison. And we have Tanaka, soon to be Dr. Tanaka Chavanduka. He just got admitted into a graduate program as a PhD upcoming scholar at the City University of New York, where he will be taking his focus will be clinical psychology. Is that correct, Tanaka? Yes, and he's also a member of the center. He's a staff member, project manager at the Center for Sexuality and Health Disparities here at the University of Michigan. He's worked on several projects for ICON Plus, which is a randomized controlled trial that utilizes mobile-friendly web app interventions. So it's focused on life skills and trainings for adolescents and men who have sex with men ages 13 through 18. He's working on this really cool project with art in the Stamp School of Art and Design, which is with queer communities. But overall, his research interests include HIV prevention for racial and sexual minorities and digital health and technology. And last, I have Miss Ayanna Walters, who's a nurse and works at Wayne State University as a research study nurse, where she provides her clients with HIV, AIDS intervention and prevention. She is also the coordinator for Connect to Protect, which is a diverse and passionate coalition committed to creating structural changes. C2P, that's what Connect to Protect. The mission is to prevent our city's youth from being vulnerable to HIV by fostering collaboration between various community partners. She's got a long history with in the city of Detroit. In terms of a nurse and a provider, and she's on several organizations that I know her personally from for the nursing world. She also is a part of, she's a founder of a nonprofit organization called Warriors Achieving Knowledge, Education, and Understanding Pathways Purpose, called Wake Up. She's got so many things that she's involved in. She's also a wife and a mother of 3, and she's just on a roll. So I know that I mentioned Detroit Community Health Connection. I don't know, Dr. Jamison, if you could tell us a little bit more about the Adolescent Health Initiative. Tanaka, if you could tell us a little bit more about the Center for Sexuality and Health Disparities real quick. And Ayanna, I know I already spoke about the Connect to Protect, but if you had anything to add, then we will get started on the questions about adolescent, young adult, and men's health in terms of sexual health. So Dr. Jamison?
Sure. So very briefly, Adolescent Health Initiative, also known as AHI, is a multidisciplinary group within Michigan Medicine. We have two co-medical directors, myself, as well as Terrell Bravender, who is one of the pediatricians who does adolescent health also. And the goal of AHI is really to go out into different parts of the country and actually work with other clinics to be more adolescent friendly is one of the best ways to provide it. And also to provide them with the tools that they need in order to improve adolescent healthcare.
Thank you for the introduction, Dr. Burns. And so briefly, the Center for Sexuality and Health Disparities is a research center housed within the University of Michigan School of Nursing and includes faculty and researchers from across the university. Our main vision is to reduce sexual and reproductive health inequities through academic scholarship, with our mission being operating from a social justice framework. The center aims to improve sexual health and reproductive health, reduce health disparities in marginalized communities, and our research identifies multi-level factors that influence sexual and reproductive health and develop innovative tests and interventions to address them. And we have a great team of wonderful staff members and faculty that work with a number of other institutions across the country to deliver our interventions and do our research.
And Ms. Ayanna, did you have anything to add, or did you want to continue?
No, I didn't have anything to add. Just wanted, well, I guess I can add that C2P is Connect to Protect, has various different community agencies that come together and for the common mission and goal. So it's, throughout the city of Detroit and Metro Detroit, different community agencies that's coming together. And thank you for the introduction.
Thank you. But I also want to give a shout out to this group chat here. Wow, Wayne State University School of Medicine, way to come through today. So thank you for everyone who's attending. I see we have the Center for Sexuality and Health Disparities. We have some people who are counselors here and people who just want to know about Michigan Medicine. We have the Physical Medicine and Rehabilitation Department. So we just want to thank you all for showing up and showing out today. So I will now start some questions to our speakers, and it'll be about their expertise. And at the end, if you all have any questions that you want to drop in the chat, please let us know. And again, I thank you for attending today. So the first question is, so what is the most significant barrier to getting tested? And then why don't people get tested or screened? And then the third one is, how often should someone be tested? So let's start off with the first one. What is the most significant barrier to getting tested?
I guess I can start. One of the barriers of getting tested, especially for HIV testing, is the stigma. Stigma that comes along with HIV. A lot of individuals or young adults are just, won't say they're scared, but they're just wait to the last minute when symptoms come, signs and symptoms come. That's one of the barriers, and I guess in the fear of finding out what the results are.
I'll also add on top of that, I think a significant barrier is really accessibility and really trying to navigate the infrastructure of getting tested, right? Sometimes just making the phone call, setting online appointments, online portals, all those different touch points can kind of be burdensome to someone who needs to just get tested quickly and efficiently. And so it makes it difficult to kind of motivate others feeling motivated to go out and get tested in the first place.
I will completely agree with all that was said, as far as particularly the stigma that we've seen, particularly in some of our adolescent patients, especially when they're trying to look for STI care and testing, as well as just being able to find the proper clinic where they don't feel like they're going to know somebody if they show up there.
Okay, so, so how often should someone get tested? And so you already answered the second question. So why don't people get tested? We talked about stigma, accessibility, and those type of things. But for the general just knowledge, how often should people get tested, whether it's for HIV, whether it's for gonorrhea, chlamydia, syphilis, any type of screening? What are the recommendations? Anybody can take that question. So, Dr.
I'll chime in there on that one. Yeah. So it depends on the sexual activity of the individual as well as their participant, particularly for HIV. It also depends on if they're taking a medication known as like PrEP. So with the medication like that, pre-exposure prophylaxis, as far as that goes, we'd want to come in every 3 months, particularly to get testing, make sure they're not contracted HIV or any other STIs as well. And then really, unfortunately, the CDC and what is known as the USPSTF, this is kind of like the guideline book for STIs. They really only have a recommendation for women certain ages, starting at 20, really to get tested once a year annually. And then it will increase some based off the amount of sexual activity that a person is having, as well as their partners.
So one of the questions I probably should have started off with in your experience, and all of you all have different experiences from being in the clinic to research to working in the actual community. Why are young people disproportionately impacted by STIs? And then more specifically, young men. If you could answer either one of those, that would be great.
I'll say in my experience, often men not necessarily having a clear conversations with their sexual partners about their status, or not necessarily having an explicit conversation about their status when they were last tested, the results of their last tests, and things being left out, being very vague, but still having, high sexual activity, as resulting in STI infections.
I guess well, you can go ahead.
Please go ahead, Ayanna.
Just to piggyback, yes, having that conversation, and what our experience is, a lot of the youth, they don't talk about, getting tested or having safe sex or having those conversations there. This is not being comfortable having that conversation among their peers. That's, has been some of our experiences in the clinic.
I will piggyback and add on that, particularly gearing in towards the conversation regarding men. What we find is that for a lot of women, they have an OB provider, or they've come in for pap smears or also for birth control. So they're already in the system. And so someone then at some point is starting to follow up on them. For men, a lot of times they've gotten their physicals, whether it's been in middle school or high school. And then after that, depending on what they do, they really don't seem to come in unless someone says, maybe you should go to the clinic or get tested or something like that.
So putting priorities for the young men, or just men in general, like on pre-employment or sports physicals and those type of things seem to take priority, but the actual conversations may not be at the top of the list when it comes to their overall care, or maybe they're just not coming, correct?
Right, that seems to be very correct. I had a gentleman the other day, 42 years old, and the only reason he came in was because he started truck driving classes. And so he had to have a physical, particularly for that. He hadn't seen a physician, the way he told me, in several years since he was in high school.
And I know it varies in terms of the need, but for any of you, when should that conversation occur? I mean, should that occur at every single visit? Should people be tested or offered any of this at, at any point? Or how can we get them to come in terms of getting tested?
I truly believe having them to come in and get tested, making it a more comfortable atmosphere. And I think that's one of the questions I may have. But as far as like getting teens to come in, as far as the adolescents, not just having them to come in just for testing, bringing everything as a whole. Like we've had teen summits where you're just not talking about sex education. You're talking about job placement, college prep or trade school, just not just focusing on that, to make it more comfortable. Because I think a lot of our youth and actually teaching with the parents, having them to be comfortable to have that conversation. Because a lot of the youth don't have that comfort of going to their parents and talking about, well, I need to go to the doctor, or I'm sexually active. So having that open dialogue between the parents and the teens, they're making them more comfortable as far as the adolescents.
Making a youth-friendly environment and providing a place and space for the parents and the child to have that conversation is important, is what you're saying. Okay, Tanaka, did you have something to add to that?
I was just going to add, in the same vein, normalizing routine testing, and kind of normalizing going to see a care provider, getting tested, and having that just be part of your daily routine in the same way people go, either they go to the dentist or, they do their other healthcare activities, making sure people don't feel, of course, it goes back to stigma, and that they just feel comfortable being vulnerable in that situation, because whether they're not sexually active or highly sexually active, it's just an uncomfortable situation to be in. So really normalizing the process of just like, it's like any other routine, medical exam.
And also I want to add, allowing the providers to be comfortable with that conversation. A lot of times they'll come in for their physical, but some providers, I know still some providers don't feel comfortable prescribing PrEP. So having that training with the medical providers, making them more comfortable and having those conversations with the providers so they can be able to, have that conversation with the patient when they come in and say, hey, you need to get tested, because a lot of providers are, still not comfortable of having those conversations with their patients.
So don't skip over the sexual health questions and the conversations, right?
Right.
Yeah. So and don't refer them to the OB-GYN when those conversations come up as well too. I mean, although they are important, or those specialists as well. Okay, so what advice would you give? What would you give young folks, men or just or young folks period, about getting tested? Like if they're nervous about it, what reassurance would you provide? So there are people on here who are educators and providers and just like community health workers, and people relate to different folks in different ways. But generally speaking, what would you tell them? Like just, something in layman's terms, what would you tell them? Go ahead, Tanaka.
I was just going to say that for me, what comes to mind is really trying to make it, I would say for young folks particularly, very much making it a group activity, right? Doing it with your friends, scheduling your appointments together, holding each other accountable, really that social support and social dialogue that you have within your network makes things much easier when other people understand what you're experiencing, what you're going through. You can relate to each other, and there's someone else who's holding you accountable for your health and your actions, and you're doing the same for them. And so, of course, you're close to your friends and you talk about a lot of different things. So it's okay to say, hey, I think we should all get, schedule our appointments around the same time. Something we can do together, and, it eases some of the stress of just going through the system by yourself, and, interacting with healthcare providers, knowing that, your social support, your social network is right there behind you.
Yeah, I will definitely agree with all of that. I'm mostly in the clinic when I'm seeing people, so they're already there. But usually I'll say, if nothing else, find a provider that you feel comfortable with, so that you can talk to them about all of your sexual health care. And so that you feel comfortable, one, getting tested, so that you feel comfortable coming back and being able to discuss everything that needs to be talked about. I will also say I usually will direct people to some of the websites. The CDC has a website, particularly HIV.org, regarding, there's a list. Providers can go on there and actually say that they are PrEP providers, or that they do STI care particularly. And so I've had a few patients who said they just looked up my profile and that it shows that I do research in sexual health, and that's some of the healthcare that I provide. And so they feel more comfortable coming to me. So it's also on the part of the providers to make sure that they are accessible, and make the patients feel comfortable.
Okay, now I'm going to ask you all about confidentiality and the importance of confidentiality. So in terms of like health insurance, how does that impact confidentiality? That's the first question. Especially for youth still receiving insurance through their parent. If anybody could speak to that. And then I have another follow-up question for confidentiality as well too. So Dr. Jamison, do you know?
Yes, I can take this one. It's one of the things that Adolescent Health Initiative tries to do, and they work with different clinics. It's partly making sure that you like post signs about confidentiality, and particularly throughout even the waiting room, as well as the examination room, and trying to explain to your adolescent or minor patients that this is a part of the exam that will not be, discussed with your parents. You can talk to us in confidentiality and feel that, everything is going to be all right, pending, those serious concerns such as suicidality and homicidality particularly. But for the part about being on the parents' insurance, it is talking with clinics on how they print out certain things. So the after visit summary that a lot of places do, it will print out the entire thing if it's given out to the parents. But if you have it set up within your clinic, particularly that it is something that if it is for like a well child exam, that this does not get printed out and does not go to the parent, then that is like one of those ways that you can ensure, the adolescents that, okay, your parents aren't going to see this part as far as it goes, or seeing that we talked about anything in particular that you're very concerned about. So that sometimes reassures a lot of the adolescents that I see.
Okay. So overall, for all three of you, or Tanaka or Ayanna, what is the essence of confidentiality? Why is it so important in general? Like for your work that you're doing, like in terms of whether it's the research or whether it's like, connect to protect. Tell me what that means to your the people that you work with, and how you talk about some of the sexual health and those type of things.
Confidentiality is so important, especially within our clinic at Horizons. Again, going back to the stigma of HIV, we have some, as far as letting them know, diagnosis or ongoing is so important. When we stress that everything is confidentiality, even if they're newly diagnosed, their partners are notified through partner services. So there's nothing is leading back to them, just letting them know that they possibly been exposed. So we stress that is so important. As far as, with research, we've had patients where they brought in family members, and we used to have certain codes where, you couldn't say certain things in front of, because we wasn't sure if family members knew. So it's just not, you just don't go in there and assume and say, hey, we're going to talk about your medications, or on this HIV study, it's different codes and different things that we go about doing that.
Okay.
And I think for me, in some of the projects that I work on dealing with adolescents, a lot of the topics are very sensitive. And so even when we're dealing with confidentiality, thinking about from the data collection all the way to dissemination, and when we're writing our science and putting it in journals, still protecting that confidentiality all along the way, because even in those spaces, right, someone can be identified, someone's reading it, especially if it's in different communities that are really small, and it's just easy to pinpoint someone based off of context. So really protecting that information, and also respecting that our participants taking the time to share their information and their status with us, that in the future, we're going to come back to them and ask for more information and to understand their experiences. And so protecting that trust and ensuring that privacy means that they can rely on us in the future, and then we can continue to do this work. And so it's something that we stress from the beginning to the end, so that we don't, that our participants don't lose faith in us and being able to protect their identities, information, and their status.
Thank you. I did see in the chat that there were questions about testing and resources. and so we'll, at the end, I'll ask all the panelists to provide resources and condoms and testing and those type of things. But I do want to say that, you know, and I know some of the other panelists can say that there's something called minor rights. And so starting at the age, I believe it's at 14 or 15, they can go get a test, any STI test, and also other services such as mental health counseling and some other things without the consent of a parent. It's different in each state. And so Michigan, so you have more rights in other states, but, you know, so there are school-based clinics who can do testing, but not all the clinics that are inside the school, depending on if they're affiliated with like a Catholic organization or such, can provide condom. Well, they can't provide condoms, but they can't, the testing and treatment options are different. But there are also school-linked clinics, which are outside of the school, so they don't have to follow the school policies. And you see a large amount of young people come to get testing from those places in the city. And you can also go to your health department as well. So I don't know if anybody had anything to add. Yes, so we have some, so if at the end we will talk about the resources that these are all experts here in terms of both working in the actual community and providing really strong information to this population. So, but we're going to, I'm going to ask specific questions to each panelist now. So we did a general overview of just young folks. And I know some of this is going to now be geared towards young men. And then also their own personal experiences through the work that they do. So I'm going to start with Dr. Jamison. So can you tell us more about expedited partner therapy and why you support its use in clinics?
Sure. So one, expedited partner therapy, also sometimes referred to as EPT, is really the clinical practice of being able to provide treatment for an STI, particularly chlamydia, gonorrhea, and now also trichomoniasis, to a patient's partner without actually having to examine the partner at all. So you don't have to have the partner does not have to come into the clinic. They don't have to be seen. What'll happen is if I have a patient who comes in and they test, positive for, let's say, chlamydia, I can then, of course, I'm going to treat the patient that I have, but I can also give a prescription, or in some cases, they give out pre-made packets of medication for them to give to their partners. I will say the beauty of this is that you can also do this for however many partners they've had within the last 6 months. And so if it's 6 partners, 9 partners, 2, whatever, you can definitely say, okay, we can provide this and give it to you if you're still in contact with your partners. If not, if they're concerned about maybe not wanting to talk with them, we have some ways of trying to get in touch with those partners and let them know confidentially that, hey, maybe just by a simple text or something like that, to be able to say, maybe you should come and get tested, or we have expedited partner therapy that you can pick up at our clinic. And so that's pretty much the simple gist of EPT. It is not practiced in every single state. South Carolina is still currently the only for sure holdout where it is still in their legislation that they cannot do that. There's 2 other states where it's kind of iffy, but the rest of the states does have a green light where it's permissible to be able to provide that.
Dr. James, can I ask a follow-up question on that?
Ooh.
So if someone's partner comes in and picks up their medication, do they also have the option of doing the same for their partners that they might have had?
So we use the word index patient, so that would be my patient, and then the partner. That partner can then not be able to pick up other medications for other partners outside of that. They would then either have to come in, or what we usually say is, send your partner over to see me or something like that. And I usually tell most of my patients that, I tell them the days I'm in clinic and I can just, have a test order for them. It varies by different clinics for that. Does that answer the question?
It does, yes, thank you.
So back to Dr. Jamison. Well, so what is the importance of the partner then? Because oftentimes in clinical practice, you see a lot of services are geared more towards females. Yes. So in that sense, because there's not a lot of, I don't say a push, but it's just, things are more designed around birth control and those type of things. So like, what is the importance of the partner? And then like, when you look at both parties, how does that impact like expedited partner therapy?
Correct. So I definitely, first off, it takes two to tango. We know there's always a partner that's going to be involved. Our real concern, and one of the important reasons for EPT, is that reinfection rates occur. So I'll have a partner, I'll have a patient, they'll get tested, they'll be positive for chlamydia. I'll treat that patient. And then maybe in about 3 or 4 weeks, they'll come right back and tell me, oh, I've got chlamydia again. And of course, I ask, how many partners, has anything changed, anything different? They'll say, no, I have the same partner. And of course, you're asking, did you tell the partner? They'll be like, yes. Did the partner get a chance to actually have to go find a clinic, call a clinic, all the barriers we talked about before, and actually go get tested, and then did they go get treated? And so being EPT takes away a lot of those barriers that the partner would then have to go through, and then we're able to treat them. And then also, I will say, like we discussed before, that a lot of my patients, they're usually women, because they're already coming in for either their pap smears, or they're coming in for their birth control, as we discussed before. And so sometimes, usually it's the fact that it's a lot of the young men who are getting the EPT prescriptions in that case.
Interesting. Okay, Ayanna, how do you reach young people for sexual health education outside of the school?
With C2P experience, and also with Wake Up, we've done team summits, like I said, bringing everything as a whole with sex education, not just focusing on sex education, making it more comfortable. And what inspires with the team summits, incorporating music, art, spoken word. So making it a more comfortable atmosphere to talk about sex. Having different platforms, drive up or mobile testing units outside the schools, that we know where it's not allowed at certain. There are some schools that do allow testing, but or condom, or don't allow condom distribution, but having different events to incorporate sex education outside the schools.
Does some of that require parental consent? What's the extent that, in terms of the parent is involved versus the independence of the teen or young adult?
It does. Well, I guess, say 50-50. Some of the events we've had did require parent consent, and others it didn't. Like when we had the drive up testing events, it didn't require the parental consent. But I say majority, well, like I said, 50-50.
Okay. And switching subject a little bit, how can clinics better gear themselves toward the needs of young men and encourage their use of services?
Incorporating more services, not just sexual health, mental health. A lot of our young men have issues with not, having jobs. So incorporating those services for jobs, homes. A lot of our men are homeless. So just incorporating a lot of, I guess if you get the funding, but funding to incorporate mental health, job training, and help with getting home. That can bring the youth to come in more, because you're not just focusing on the sexual health, you're focusing on everything as a whole.
I think I totally agree with that. I'm gonna move on to Tanaka real quick. So I know that you do a variety of things with digital technology, but my first question is, how do the sexual health needs differ between heterosexual and sexual minority men?
That's a good question. I think the needs differ in that sexual minority men have a different relationship towards sex, sexuality, and seeking partners. And so in that, just the way that they kind of approach sex and talk about sex, I would say there's maybe less of a stigma, and it's more open. And so in that, some of the dynamics that we talk about, it just might be easier just to see in sexual minority men versus heterosexual men, where it still might exist, but it's not easily identifiable in the same way.
Okay. And I personally really want to know about this, the media and the technology, because, that's one of my interests. So how is new media or technology changing the delivery of sexual health education?
Absolutely. I think technology moves really fast, and so at that pace, it means that we're able to deliver information, deliver services, really where everyone is, and right, we can meet people where they are, even if that's in digital spaces. And so whether that's on Instagram, Facebook, TikTok, all these other platforms that you can create content for, deliver that content, and then you're able to get people either into a clinic, you're able to educate them about different sexual health needs and understanding. And so it ideally that it lowers a barrier to entry in certain communities, and then there's still the conversation around making sure that individuals in other communities have access to technology to see this content and to interact with it. But it means we're able to do like at-home testing and at-home deliveries for certain things, as long as people have that technology available to them to receive that connection.
Very nice. Very nice. So I have two more questions, and then we can open it up to the folks who are all online with us. The first one is, and this is for any one of you can answer this. What should clinicians know about communicating with young men regarding their sexual health? Like, what should they say? Like, if there's a conversation, like, how would that take place? Like, just seeing that, some of the things that we've talked about today.
I guess I can go. Having that setting those cultural biases apart, making sure that you're able to relate with the patients per se. I think that's a main concern with the cultural biases, is putting those to the side.
I will piggyback on that and definitely say, I think one of the things is when you're talking with or communicating with any of your patients, you want to make sure that you have a non-judgmental tone for sure. And that, you're not acting surprised or shocked or anything like that when they have certain answers, which I admit is sometimes difficult to do, but the goal is really to try and make your patients feel comfortable and being able to come and talk with you about what's going on in their lives and their healthcare, because that's the only way you can really help them out.
Okay. Tanaka, are you good? Okay. So from all of you and your experiences, whether it's working in the clinic, whether it's working in the community or research, or whether it's in like a digital space, what resources are available for testing and screening in Detroit or online? Are there low cost or free services available? Like where would you find some information for testing, screening, and even education? I know the CDC was mentioned, but if any of you know any great apps, or if you know places in the city of Detroit or in Southeastern Michigan or online or from your own personal clinics, can you let us know what those are?
Well, I know City Health Department, they offer free testing where you can request it online now because of COVID, because a lot of things have changed because of COVID. Horizons Clinic, which is at 400 Mac, they have HIV testing appointment, again, because of COVID. It used to be walk-in. Unified, Ruth Ellis, CHAG and Detroit Recovery Project, they have mobile testing units. But again, a lot of things kind of changed because of COVID. So those are some of the resources. And we discussed this today in C2P meeting, where we're formulating a listserv of different community agencies that are offering free HIV testing. Also, Teen Hype does testing as well. But again, a lot of things have kind of changed because of COVID.
For healthcare professionals, the National Prevention Information Network, available through the CDC, it's available for anyone to join. And it's a network of professionals where they have a host of tools and resources that are tailored and can be tailored to your specific communities and populations. And so from digital resources to campaigns, to like social media posts, they have it all housed there, and conversations around things that people might need for the future that are developed by healthcare professionals around the country.
Exactly. And the most recent CDC STD surveillance report just came out. And with that comes a whole lot of different infographics that providers can use, different clinics can use also to try and send out to get the message out to their patients as well, to get them to come and get tested. And I'll put in, there's also a website that the CDC has, just gettested.cdc. I'll put that into the chat where anybody can use that across the nation, put in like their zip code, things like that, and try and figure out like where's the place they can actually go.
And I see that we have affirmations in there also as a place to go for education, just community and those type of things with young people. So at the end of this, we are going to send out a survey. Actually, if Mackenzie, if you drop that survey in today, we are going to send out places where folks can get condoms at for free. And then also testing and you know, stuff for young folks, and then things that are geared also toward young men as well. And so we'll send that in through Eventbrite, and we'll make sure everyone gets that information. Now we have a lot of people on the line. We have people who are supporting. Are there any questions that you want to ask these panelists? I mean, we've talked about you know, why young folks are impacted more by STIs. I know it comes out in the CDC annually in terms of, or in other spaces annually about some of the statistics. We talked about expedited partner therapy. We've talked about community resources. We talked about the difference, you know, again, between young folks and then young men being impacted by this, and what providers should say, and how people can provide education. What questions do you have and for these panel of experts? Because we're looking at 3 spaces. We're looking at clinic, research, and community. And we don't usually often put those 3 together. You usually see a lot of community members. But for us to work together, we have to understand how all these things work. I mean, we can talk about young folks and what they need, or young men and what they need. But if we're not creating interventions and programs that address the needs of these individuals, we're not doing our due diligence, we're not doing our service in terms of how we're servicing these individuals, and the rates are not going to decrease. So what, I mean, I'm putting the Wayne State School of Medicine people on blast right now. What questions do you have for our speakers? Please don't be shy.
So I've got a somewhat interesting one. It's something that is frequently ignored when I've asked this, but let's say someone's working in a clinic where they are working with patients who are both LGBTQ, and they also have other patients who come from a more conservative background. So how would you create a space where both patients could get the care that they need while not feeling uncomfortable?
So I'm going to take this real quick. I'm Southern, so being able to work in a conservative environment is very easy for me, as well as the fact that obviously working in this space, I try to provide care for every single person that I interact with. And I think it's really based off the providers, as well as in a clinic setting, and also has to be in conjunction with the medical director to explain to them that, you know, this is the care that you want to be able to provide to anybody who walks through your door. And you want to make sure, whether it's sexual health care, whether it's birth control, anything that someone could need, that it's available to you from a physician standpoint. And that you make sure, like if you have a website or whatever it is the clinic has, that it is posted on there that, you know, we're welcoming to everyone. And I think that's one of the key things. And I've definitely worked in places in residency that were extremely conservative. And it was still a matter of being like, I don't care, even as a resident, I want to be able to provide this care to my patients. So it's really about the provider making sure that they stand up for their patients and be able to give them the care that they can.
That I was on mute. Thank you for that answer. That was a really good question. You know, sometimes we want to make everybody feel comfortable in terms of the care. And that means starting with the front desk, starting with the paperwork, starting with the EMR systems in terms of how folks, identify, or just understanding the mission and vision and values, and making sure that, they try for like, especially clinics, that they try their best to, really service the folks who need it the most, So I think that was a really good question. Because sometimes there can be sticky situations, but I thought that was a great answer. So we have a question. Do you have any advice for future providers, Wayne State University School of Medicine crew, on how to create an atmosphere where patients feel comfortable accepting offers for STI, HIV testing and counseling on safe sexual practices, especially adolescents? I know it was mentioned that they talked about ensuring confidentiality, but are there other things that we can say or do, which I think is a very good question. Anybody want to take that?
Well, I know C2P and MOESH, we had a training, I think it was last year, where we had youth were the panelists, and basically they told medical students certain questions that they thought was needed when they went to the doctor. So having more of those trainings, and the feedback from that training went really well, because a lot of the medical students, they didn't know those questions. They didn't realize that how youth, adolescents, how they felt about certain things, like addressing them according to their pronouns. So that was very helpful. So I believe having more trainings with youth, with medical providers, just having those conversations.
I will completely agree with that. In terms of what Adolescent Health Initiative does, we actually have a lot of courses and programs on the website, but also we have a membership, like a group that is just made up of adolescents, and they advise us on really what we should be doing and the work that we should be providing to different clinics, and particularly with making adolescents feel comfortable with being able to discuss these things. And just like Walters was saying, I'm Southern, so sorry, Ayanna was saying that we would be, making sure that they're comfortable, the questions that you should ask, again, particularly the pronouns, and that also starts at the front desk, even with some of the check-in sheets that they have, sometimes that's not up there. So again, making sure that is something that your clinic looks towards providing and doing. Particularly from the resident training med school background, it is making sure that when you ask questions, that one, you are comfortable asking them, and that you try and make, again, it's all about your comfort level with that, and that will be then internalized with the patients that you have. They can tell that you're comfortable talking about these different activities and things like that.
Thank you. Those were great responses. We have another question. This may have been touched on already, but what is the protocol for a patient who has been diagnosed with a sexually transmitted infection and has been sexually active, but does not want to tell their past partner?
So I'll start with that one and hope someone can help out as well. Really, it is, you really have to talk with them. Like, let's say, they have chlamydia, they've been tested, you've brought them in for treatment, you talk with them regarding the reasons why they don't want to talk with their partners. Maybe it was, a one-night date from Tinder, Grindr. I know there's other apps, but that's where Tanaka comes in, and I would rely on him for that one. And so it's really like, do they have the phone number for this person? Is there a way for them to get in contact? Is there a stigma around why they feel like they can't tell them? And really just trying to do your best to educate your patients on the reasoning why we want to make sure that we get treatment out to everyone.
I wouldn't know the names off the top of my head, but there are anonymous texting services where you can enter the information of your partner, and the texting service will text them and let them know without you having to interact with them directly, and not necessarily exposing your identity. Well, so like, while it's not like a perfect solution, it still like notifies the partner without having to kind of have that interaction. Other apps, not necessarily Tinder, but more queer apps like Grindr, Scruff, all these other ones, right? Trying to do pilot testing around mechanisms to notify partners within the app that they may have been exposed, and also being able to display recent test results in those apps, like verified test results. And so there are other technologies on the market trying to do it, but it's so hard because it's hard to address, and it's hard for people to talk about, and the healthcare system in America isn't very uniform, and so it just changes region by region. But there are options for people if they don't want to necessarily have that conversation face to face.
That public health professional practitioner coming out, right, Tanaka? Alumni of the U of M School of Public Health. That was good, like in terms of the anonymous piece. And that's good information for people to know, whether, they don't have to be face to face all the time. We have time for one more question. So if anybody wants to speak real quick or drop it in the chat, we'd appreciate it. We really are thankful for everyone who showed up today, especially on Friday at 2 o'clock. This means a lot because, like I said, for the CDC, this is the end of STI week and the awareness week. And, this information needs to be out there because it's changing. It's changing. Everything is changing in the way that young people, young men, everything in terms of the information. So this is very relevant right now. So yeah, a platform to tell your partners to get tested, tell your partners. So that was just adding in the chat. Is there anyone else?
I have a question. So I've noticed from the research side, there are definitely some changes that we've made because of the pandemic that we realize are very helpful modalities to keep participants and people engaged, and also better ways to get people tested on their own terms, whether that be like testing at home and like actually sending kids at home and doing testing via Zoom, right? So I'm curious from the like clinical and the community sides as well, are there different changes that you've made because of the pandemic that you think you will continue using because they're actually accessing more folks and keeping people engaged? Yeah.
So I will definitely say there's a lot of things. Well, first let me say I work for this small school called the University of Michigan, so I can't say anything I want to keep particularly, but for one thing, for expedited partner therapy, it was only being used for chlamydia and gonorrhea. After the pandemic started, they expanded this to trichomonas. So that was a helpful thing. The state, under Dr. Jolene Caldoun, decided to also send out condoms that people could just ask for in the mail. And they would come in this little brown paper bag and would get sent to your place. And for research, we actually had a few addresses sent out and had to try to get them back. And they actually came in a really good time. They came with 10 condoms, 2 things of lube, and something else I can't remember that we did. But that was a great benefit. Also, like you mentioned, being able to do STI screenings over Zoom or whatever the platform is, the video virtual visits is great. And then the patient can just go to any clinic, particularly for us, any clinic that's attached to the University of Michigan, pee in a cup or do a swab, and then we can be able to send them out their treatment if they need. That is also something that's great. So I think there's a lot of things that came out of the pandemic that I think should stay and help to, again, decrease some of the barriers for a lot of patients trying to get STI treatment.
Thank you. We have a quick question. How can we get more information on those trainings that you mentioned, both to Ayanna and Dr. Jamison? It would be extremely beneficial. I don't know if it's something that you all could send me, and then we plan on sending out the link to this presentation and some of the other services, but I don't know if you all want to send information to me or just tell the individual real quickly where they could look up.
I can send it to you. Send it to you to disperse to everyone.
Okay.
Yeah, I can do the same, particularly for AHI's information.
Okay, so I hope that sounds okay to the individual who asked the question, and that information will be for everybody. Is there anybody else that has anything to say? Okay, so I'm excited. It's Friday. So I hope everyone has a safe weekend. Do something for yourself, self-care, watch a good show, spend time with your family. We appreciate you all, and friends and animals and all of that. We appreciate you all for coming today. Again, this will be this recording will come out through the link, the Eventbrite link, and then if there's any other questions, feel free to email us. Okay, so take care and thank you so much.
Thank you for
Thank you
having
very much.
Thank you.
Speakers, stay on 1 second. Please stop the recording. Thank you.